Yeah, because he'd been assessed as well, presumably.
Yes, although we'll come on to that,
Okay,
because it was a slightly different case.
All right, so here we are. You've got to the fourth assessment. They've declined to arrive at any conclusion for 6 months.
Well, yeah, then it went on to October.
You can't appeal. So this is now 10 months.
Yeah.
You can't appeal because without the judgment, if you like, you can't appeal it. So this is now 10 months. Presumably, were they hoping that perhaps your mother would suffer some sort of catastrophe?
I think, actually, at that time, there were so many people raising this issue that there was just this huge backlog. But that doesn't excuse the fact that there was just no communication.
Right.
But at that time, this was a real low point, because at that time, my mum ran out of money to pay for her care. There was no more money. And I wrote to social services and said, you have to help us. You know, what do we do? How do we pay for care?
What would they have done? Thrown her on the street?
Well, I applied for temporary financial assistance, which is emergency funding.
Did they say you should pay?
The care home did at one point come after me for money.
They came after you?
Because they need to be paid. But it's a really difficult situation. So social services then started to fund her on a temporary basis, which we would then have to pay back. But at least, you know, she could stay in the care home.
Because she still had a house?
Yeah, she did still
father's?
have a house, which was, at the time, we couldn't sell it because it had subsidence, but that's a...
You had tried to sell it then?
Yeah, we had tried to sell it.
Okay, but at least they had that house.
So still nothing from the Strategic Health Authority, so I wrote to the Healthcare Commission again, and they said that on account of the delay, maybe they should fast-track it to the Health Service Ombudsman. And very strangely, at that point, I received a date for the tribunal.
But they'd been in the tribunal already, hadn't they?
No, this was the one I was waiting for, the independent tribunal.
Sorry, hadn't it already happened in January?
No, so it was now a year on.
Oh, I'm sorry, I thought it had happened and they just hadn't arrived at a judgment.
No, still waiting for the tribunal.
I beg your pardon. So a year on...
A year on, we finally got a date for that.
For the tribunal.
And Simon and myself, together, we put together a submission for that. The guidance that Simon was able to give me was excellent.
What was the guidance, Simon?
Well, there's been a lot of this going on, so there was a lot of information. At this point, when Angela was going through these difficulties, I was not versed in this area of law, so I had to learn it as I was going along. And it became very clear to me that there's a huge gap here where there is a tremendous need, but it's not fulfilled by the authorities that exist. So I had to go and find where the law was and put together an argument for. And it was then when we discovered these cases, which have now become landmark cases, and you mentioned one just now, the Pamela Coughlin case. And we put a submission based on the law, and in particular on Angela's mother's condition. And you've got to bear in mind that this tribunal also doesn't see Angela's mother. So we had to depict what she looked like and show
photographs?
Well, no, we had to do it in words.
Like mime, like Marcel.
No, just simply in words, talking about what she can do, that her state of health, her skin condition, and the fact that she's mainly confined to bed, her cognitive skills, or otherwise, as the case may be. And by doing that, we were able to describe this very poorly woman to, in our view, hopefully make them understand that this is a case of primary health need. To take the example, this Pamela Coughlin suffered a terrible car accident in 1971. And as a result of that, she was wheelchair-bound, very serious injury, and she couldn't care for herself. If you were to see her, you would see that she's a medical need. And yet it took, this case went all the way to the Court of Appeal. It won in the High Court. The NHS appealed it to the Court of Appeal. They lost. And as a result of that, we had this very good precedent that said, this world here is in disarray. It needs to be tidied up. The guidelines that are issued are all over the place. Some NHS authorities deal with it this way, some deal with it that way. There's no synergy between them.
Do you think that there's pressure on the Primary Care Trust or the NHS generally to refuse these cases? because of the cost?
Well,
Is it all about money?
as a cynic, I'd say absolutely. Of course there is. I'm sure there's lots of people who do these assessments who go to work with the intention of doing a very good job in accordance with the law and the rules and regulations that apply. But I can't help but believe there is a need to protect the public purse so far as these people are concerned. So they would like, ideally, the NHS to pass it over to the local authorities, who'd like really very much to send it back to the NHS.
I've got a text here from Paul in Warrington. He says, it's advisable to get a lawyer to safeguard your home. Give it to a family member. If not, the state will take it from you to pay for care. Is that advisable?
I wish it was. It's not quite as simple as that. If you've deprived yourself of an asset with a view to helping yourself, if you're going to go into any form of care, then the asset can be recovered.
Well, the law, the government can go after your house, even if you've given it to
it can be got
your daughter,
back,
for instance.
Absolutely. There are certain time
There
limits.
you go, Paul.
There are certain time limits involved with this. But it also depends on your intentions. So, regrettably, that's a very simple way forward, and it's almost a good barrackroom lawyer's point. But regrettably, the law's caught up with that and says no.
Okay, so you can't do that. So you advised Angela, and you put together this case for her. So on the day itself, tell me a little bit about this appeals panel or whatever it is.
It was made up of about 6 people. When we got there, I was a little bit unnerved because actually 2 of the people, I think it was 2, were actually from the NHS, which I thought was a little bit not really independent.
Oh, well, the people who were deciding.
A couple of the people were
from the NHS.
Which not from the same area.
It's like me deciding whether I should pay tax or not, isn't it?
It is, although they were from a different area. But it was still, it just didn't seem quite right. But we went into this room where there was a panel of people, and we were able to put forward our case and answer questions. And we were in there for, I guess, about an hour and a half.
I was expecting something which was rather awkward, having regard to the difficulties Angela had already experienced in putting these submissions forward by letter. But they were very good at listening to what we had to say and hearing our argument.
All right, so they listened nicely. What happened next?
And then we went away. They did what they did, and they had to come up with a decision. And fortunately, they decided that my mum had been paying fees illegally, and she should have been funded. And they agreed to backdate all of the fees from about April '06.
Right, we're going to go for a break now. If you'd like to text in your questions or comments for Angela Sherman or Simon Stone, why not do so now to 87778 with the word EDGE, and then your text, and we'll see you back here very soon.